Welcome to part 2 of our discussion on long-term care services. In part 1, we explored the different types of long-term care services there are and how much they cost. In part 2, we're going to explore what Medicare does and does not cover when it comes to long-term care services. My name is Spencer Ford, CEO and Wealth Advisor with Conservative Financial Solutions, also a certified financial planner professional, and we're just going to get right into today's topic. I wanted to address the topic of how much Medicare provides in terms of long-term care coverage because many families mistakenly believe that it covers a lot more than what it actually does. Here's an excerpt taken straight from Medicare.gov. It says, Medicare does not provide long-term care coverage or custodial care unless medical care is needed. The difference being drawn here is between medical care versus personal care. So Medicare will cover a stay up to a limited time in a skilled nursing facility if certain requirements are met to administer medical care. An example of this might be to provide someone who fell and broke a hip and they need rehabilitative care, or someone had an infection and needs some ongoing treatments to recover but don't necessarily need it to be done in a hospital or don't need to receive those treatments in a hospital. Personal care are tasks of everyday life, often referred to as activities of daily living. We often refer to them as the 6 activities of daily living, which would be bathing, dressing, eating, transferring, toileting, or continence. First, let's tackle the length of time. How long will Medicaid cover or help cover a skilled nursing facility stay? So in terms of days, for the first 1 to 20 days, Medicare pays the full cost for covered services and you pay nothing. For days 21 through 100, Medicare pays all but a daily coinsurance for covered services. You pay a daily coinsurance amount. So for 2023, the coinsurance is $200 per day. Now, depending upon the type of Medicare coverage you have, like you might have a Medigap plan or a Medicare Advantage plan, your plan may cover all or part of that coinsurance amount. So it's a good idea to check with your plan to see what kind of coverage you have. For days beyond 100, Medicare pays nothing and you pay the full cost for covered services. So right about that time is the time that you would probably want your long-term care coverage to kick in if you have any. Otherwise, like we saw in part 1, things can get pretty expensive pretty quickly. So, okay, what services are covered by Medicare for those 100 days? Those services include a semi-private room, so a room that you would share with other patients, meals, skilled nursing care, medical social services, medications, medical supplies and equipment used in the facility, ambulance transportation, dietary counseling, and it's even going to cover things like physical therapy, occupational therapy, a speech language pathologist or pathology services, as long as those are needed to meet your health goal. And a health goal would be like something like being able to walk a certain distance or climb a set of stairs. Now, what conditions have to be met in order for Medicare to cover your stay in a skilled nursing facility? Because we mentioned at the beginning that it has to meet, there's a limited time that they'll cover it, and then certain conditions have to be met. So number 1, that first condition that has to be met is you have to be on Medicare Part A, which is the hospital insurance. And you have to have days left in your benefit period available to use. And we'll talk about what your benefit period is here in just a moment. Number 2 is you have to have a qualifying hospital stay. And what a qualifying hospital stay is that's an inpatient stay of at least 3 consecutive days or more, starting with the day that the hospital admits you as an inpatient, but not including the day that you leave the hospital. And time in the emergency room doesn't count even if you stay overnight. That time only starts when you've been admitted. And now number 3 is you need and your doctor has ordered inpatient services in the skilled nursing facility. That's what SNF stands for, which require the skills of a professional person, which requires the skill of professional personnel and are given by or under the supervision of these skilled personnel. And then number 4 is you need and get the required skilled care on a daily basis, and the services as a practical matter can only be given when you're an inpatient in the skilled nursing facility. So those are the requirements. Now, what your benefit period is Medicare defines your benefit period as the way that original Medicare measures your use of hospital and skilled nursing facility services. A benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you haven't received an inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the inpatient hospital deductible for each benefit period, but there's no limit to the number of benefit periods. And just so you know, all of this information is available in the Medicare coverage of skilled nursing facilities care handbook or booklet that Medicare puts out. And we'll attach a link in the description below for that. But let me walk you through a real life example. My grandfather contracted a pseudomonas infection in his lungs. This caused him to be admitted to the hospital for several days where he was placed on heavy duty antibiotics. And after several days in the hospital, so he met that 3 consecutive day requirement, the doctors weren't comfortable with sending him home, so they sent him to a skilled nursing facility for some additional care while he recovered. Part of that care was to continue the IV antibiotics and receive some physical therapy to strengthen his cardiovascular and respiratory condition. Now, between the hospital stay and the nursing home stay, my grandfather spent 20 days away from home, and Medicare paid for all of it. That was that 1 through 20 days. So what happens if my grandfather left after that 20-day period, and in 10 days he wasn't feeling very well again, and the doctor wanted him to go back to the skilled nursing facility for a few more days? He could do that, and he still has 80 days left of his coverage because Medicare is going to cover in part at least some of the first 1 to 100 days. So he still has 80 days worth of coverage. He might have a coinsurance that he has to pay, but he still has 80 days worth of coverage. Now, what happens if my grandfather, going back to the original time he was there for 20 days, he left, and then let's say it was 35 days afterwards, he wasn't feeling well or something else happened. Maybe he fell and broke a couple of ribs or something like that. Then in order to be able to go back into the skilled nursing facility and have that covered by Medicare, he would have to have another 3 consecutive day stay in a hospital. And as long as he had that and then went back as a patient, he had to be admitted inpatient, right? 3 consecutive days. But then after that, he could go back to the skilled nursing facility and he would still have those 80 days as part of that Medicare coverage of days 1 through 100. And let's say he left before he got to those 100 days. So going back to our original example again, let's say my grandfather spent 20 days there and then he left, and now it had been 65 days until he had that fall and cracked a couple of ribs. Well, then again, he would need to have a 3 consecutive day stay as a patient inside of a hospital, but then he could go back to the skilled nursing facility if that's what was, prescribed by the doctor. And at that point in time, his coverage starts over. He still has that 1 through 100 days. 3 of those days, if he stayed in the hospital for 3 days, 3 of those days would be in the hospital, but then he would have essentially 97 days that he could spend at the skilled nursing facility, and Medicare would at least pick up a portion of that benefit. Like we mentioned, day 1 through 20 is 100% covered, and then the rest of those days to day 100 would have a coinsurance or something like that. But essentially what happens is if you have to go back before 30 days, then you just start right back up. You don't have to have another hospital stay. If you go back between day 30 and day 60, you're going to be inside of that same 100-day period. If you go back after, of course, you need an inpatient hospital stay of 3 days. But if you're after 60 days and you need that hospital stay of 3 days, but then that benefit period, that starts over again, and you have 1 through 100 days. And like the benefit, like the definition mentioned, there's no limit to how many times that can happen to you. So you might have 1 year where you need some skilled nursing care and Medicare is going to cover it. It might be several more years, but then you go back in, you're still going to have a new benefit period. Medicare is going to help cover the cost. It's those extended stays that where you're beyond 100 days because something else is going on, you don't need medical care, you need custodial care, you need help with just those 6 activities of daily living that Medicare is not going to cover. And that's where we need to get into the discussion of, okay, what do we do then? How can you protect yourself from a long-term care expense? But for today's video, that pretty much covers what Medicare is going to cover for you. And again, we'll put a link in the description below with that booklet if you want more information. So thank you for watching this video. Please stick around for part 3. If you missed part 1, please go back and watch that. And then, because we talked about the different services that are provided and the cost of those. And then in part 3, we'll discuss several strategies for preparing for and funding a long-term care expense. Again, my name is Spencer Ford. Thank you for joining me in this video. And again, just remember, conservative beliefs, conservative values, conservative financial solutions, and we'll see you in the next one.